Hello everyone. I had my second adjustment today. It was originally scheduled for next week on Tuesday, but what happened was the last 3-4 days I noticed that as my bottom teeth were moving forward, they were slanting forward as well, which was creating a slight underbite. And I sing, so it was like Sunday and as well as last night, every time I would say, like, for example, a T, my teeth would hit and it would hit hard and it hurt. They said that this can happen, but it can be fixed. What they did was they brought me in today and they removed the top wire and put a stronger wire in. My bottom teeth, they told me that the first wire that I had when I got my braces was a .02, which is very small, possibly the smallest one they have because of how crowded my teeth were. My first adjustment, I had a .04, and then today they put a .08, which is, they skipped 2, and they asked me if that was going to be too tight or if I would be able to handle how sore they would be, and I said yes. No pain, no gain. Just I want these to be moved back. They are straightening out. If you see my first video especially, and even my second one, these are like, they really are moving. My top ones, however, I noticed that when I got my first wire on, or my first adjustment, they haven't moved that much. And so I asked them about that, and they said that was normal because my teeth really weren't that crowded on the top. They didn't have that much to move, and I'm really seeing a drastic move on the bottom because they were so crooked. One of the things they did tell me whenever I told them that I was making a video was they said to make sure that I let adults know that even if you're flossing, to make sure you use Listerine mouthwash of some kind, because when your tongue pushes against your teeth, it can create plaque around your brackets. Sometimes people don't get that clean well enough, so they said to let people know to make sure that they rinse their mouth with mouthwash to get that out. One of the things that I did tell them, though, when I was telling them about a video, I searched the internet and I couldn't find anything, if there's anything out there of what I'm going through. And they told me that about a third of the patients that they have are adults. And I was like, somebody needs to be putting information out there. I'm trying, but I was searching and searching. I was doing Google searches. I was doing whatever I could to see if anyone else was dealing with their teeth slanting or moving forward like that and creating underbites or anything like that. I couldn't find anything. So if you know of anyone that possibly is going through stuff, make sure they post their videos, because I am looking for information and seeing, if someone else is dealing with what I am or if this is normal. I didn't know if it was normal or not. They said that it can happen and it can be fixed. Today, whenever they did take the wires off, it wasn't as sore as I had been. I did, however, when they removed the bottom ones, this tooth and this tooth, I could wiggle it. I could wiggle it with my finger or my tongue. It was very loose. But that's good. They're moving. They're doing what they're supposed to be doing. I'm on track, they said. The next time I go, I'm sure they'll get me more wires. They did tell me that I will have to eventually have the rubber bands that they hook on, where these hooks are. These hooks from here to here, they said moving your teeth and getting them straight is easy. That's the easy part. The hard part is to line up your bite. And so they will put rubber bands from top to bottom. And I didn't realize I was going to get more brackets, but they're going to put them on my molars. And I only have 10 on the top and 10 on the bottom right now. So they're going to put brackets on my molars and to pull my teeth in place. So I was excited. I am seeing a lot of progress, and I don't regret it. I can't eat much. I am losing weight, but that's just something I'm having to deal with in the process of getting these straight. I don't regret it one bit. I would do it all over again. I know I'm 47, but I don't care. This is something that it's definitely worth doing. So again, I highly recommend it if you are thinking about getting braces. If you are contemplating it and you can, I highly recommend it. It is so worth it. If you look at my first video, even my second video, to my teeth now, it is amazing how much they've changed. My husband asked me, before they started moving forward, they were straightening out like this, but before they moved forward like they had the last few days, he was like, if your teeth looked like that, would you have gotten braces? And I said, probably not, because these two here were so far back before, and now it's like I would have dealt with that. So if you are thinking about getting braces, I highly recommend it. My next adjustment is on September the 10th. And if anything comes up, and I will do my best to pass on any information that I get or any things that I'm going through. If you have any questions or comments, please post them. I appreciate all of the subscribers and all those that have viewed my videos, and I do hope that I'm being very informative. I noticed I got one dislike. I don't know why, but if you could just let me know if it's something that I'm not letting you know about or you don't agree with or whatever, just let me know and I'll do my best to answer any questions that you may have. Again, thank you for viewing my postings, and I hope that I'm helping somebody out there that may be questioning, going through what I am, or maybe you have suggestions for me. Maybe you've gone through it and you can give me suggestions as well. Thank you, and I will talk to you next time.